Today the topic of our lecture, this is a constructure features of the structure of the spine. Before we start to talk about specifics, weaknesses, strength and so on, I want to tell you the legend which can be found on the one of the books of BKS Iyengar. Long time ago, demons disturb humanity very much. Disturb, don't let them to live in comfortable conditions. And then people went to the gods to ask for protection. First, gods met demons, but it didn't lead to anything. Gods started to be unhappy, then they start to fight with the demons, but it also led to nothing. And then gods goes to the main god with the name Brahma and ask for advice. What should they do in this situation? Brahma said, high in Tibetan mountains you will find an old sage named Dadhichi. His relics will help in battling demons. And then the gods went to the Tibetan mountains, find Dadhichi, ask for his relics. Dadhichi give them his relics, and the gods make an arrow from Dadhichi's spine. They launch this arrow at the demons, and the demons disappear. BKS Iyengar, he is trying to convey to us this legend, and what a metaphorical meaning here. Strong yogic, even aged spine, this is a serious weapon to resist the demons. By demons, BKS Iyengar means diseases, which we have many, and they really bother us all very much. Back to the topic of our lecture, here we are talking about a spine, which is a system which includes a number of the elements. At this stage, we speak about muscular skeleton system, excluding fluids, nerves, spinal cord, and so on. Exclusively muscular skeleton system. What does this system include in? First, of course, this is a bone structure, bone tissue. Bone function in this system, it's a foundation. Also, this system includes a muscle tissue. Muscle tissue in this structure is designed to perform the motor function. But not only to this, we will come back to this matter a bit later. Next element that is building a spine system, this is a ligament apparatus. Ligaments have a function to connect the bones together and keep this structure more or less stable. And of course, intervertebral discs are present in this system. The main function to prevent the bones from destroying each other during the moving process. Here we see the entire length of the spine. The spine is traditionally divided into the several segments. The first one, this is a cervical spine segment. The second one is the thoracic spine. The third one, this is a lumbar region. The separate segment is sacrum and the tailbone. They are also placed in the separate area. What is the function of the cervical spine? This segment includes 7 vertebrae. It has a function to move your head to the different direction and hold the weight of the head. Here we need to understand what is the weight of our head. Averagely, this is from 3 to 5 kilograms. Why am I bringing this to your attention? Lots of people, they qualified their limits inadequately, performed inverted positions. To be more specific, Shirshasana or headstand. They load the cervical spine with excessive weight, which is lead to injuries of the cervical spine. Before performing such a complex element, like a headstand, they should undergo cervical training to be able to accept such a weight step by step, as a cervical spine for not designed, or mean for the weights, while performing a headstand. Thoracic spine have 12 vertebrae. Each vertebra holds one pair of ribs. Ribs in this structure are designed to protect internal organs from external mechanical effects. Going down to the lumbar area now. Here we can see that here are most of massive vertebrae, most of massive vertebral bodies, massive intervertebral discs. A muscle bandage is very strong here. Lumbar segment have 5 vertebrae. And here we can assume that this part is most protected. But at the same time, I wanted to draw your attention at when someone will say to you, their back hurts. First of all, we think about the lumbar spine. Why we think like this? The thing is, is the function of the lumbar region is to hold the weight of the whole upper body. In the upright position, intervertebral discs are under constant compression, under constant pressure, which leads to the squeezing the fluid from the cartilage, from cartilage tissue, and leads to thinning intervertebral discs. Further on there happens a pressure on the nerves or nerve endings. It leads to pain. Going down below, we discover a sacrum segment. In this part, child have 5 separate vertebrae with intervertebral discs between them. The growing human here has one bone. Upon reaching a certain age, bones start to grow into each other, creating a monobone, which we know as a sacrum. It was created to connect the spine with a lower foundation. And we know this foundation is like a pelvis. Pelvis is a sort of transitory part between upper body and the legs. The next element in the spine is a muscle tissue. In this context, we talk exclusively about skeletal muscles. As we already find out, muscle tissue function is a motor function. However, there is several other functions. One is which is stabilization. The fact is that some muscles of the spine do not relax in upright position. They relax only when we lie down, and they do not perform their stabilization function. Next element which we will sort out is the ligament apparatus. As we already find out, ligaments are meant to keep the spine more or less stable, since they are located between the bones, and fix them with each other. Ligaments include 2 main components. The first one is elastin, which allows the ligament to stretch some way, and collagen, which keeps the ligaments from overstretching. It is said that in the healthy ligaments, there is around 80% is the collagen and about 20% is elastin. Everywhere in our body is exactly this percentage. However, here we need to go back to the cervical region, where the figures will be opposite. There is only 20% of the collagen and 80% is elastin. Exactly for this reason, neck area is so mobile. What does it tell us also? We pay special attention for fragility of the cervical region, how easily it can be injured. Specifically because of proportion collagen and elastin, here has the opposite ratio also. And the final part of the muscular skeleton system is the intervertebral discs. It includes wall layers, outer layer and inner layer. The outer layer calls fiber ring. It includes up to 65% water. What does it tell us? It has an important component in regeneration processes, in nourishing processes, and so on for fibrous ring. Another element of the intervertebral disc, this is the nucleus pulposus. Nucleus pulposus can be up to 88–90% water. This is a jelly. This is very fluid substance, and without water it just can't exist anyway. How can intervertebral discs collect required amount of liquid for quality productive life activity? Blood vessels pass near the spinal cord. Small vessels will deliver the fluid to the intervertebral discs through the bone tissue. As we can see here in this image, we can say everything is fine. However, this system works into the woman's body until the age of 20, in the male's body up to 25 years. After that, the vessels collapsed and disappear. Here we offer you to stop the lecture and think about that how intervertebral discs can collect that required amount of the water, which will be sufficient for effective life activity. Well, we hope you have some ideas. Now let's talk about reality. It is said that at this stage the process begins in the human body, which is called osteohondrosis. Osteohondrosis is mistakenly called disease by many. Osteochondrosis is not a disease. This is a primary degenerative process which occurs in the intervertebral discs based on specific of interaction with the circulatory system and leads to the development of the secondary degenerative processes, which are already diseases. So osteochondrosis is genetically programmed in us. It's a natural program. We can call it a death program. From now, the intervertebral discs start surviving. They start collecting water from everywhere. From anywhere, only this is possible. And from where impossible also. Well, let's observe two groups of people. First group, this is a group of people who do some physical exercise. Since we're talking about yoga, let them do yoga. The control group will not do anything. Let's think, which one will have more back problems? Of course, it's those who don't do anything. What is the difference between these two groups? The difference is that group that practices yoga, they move. Going back for previous information, in order for us to understand what a body uses to move. And that's how you remember this is the muscle tissue. What muscles need to do in order to contract? They need the energy, that is oxygen. Oxygen will be delivered to muscle tissue through the circulatory system. You can imagine or even remember how do bodybuilders look like after a class in the gym. They look so enlarged. This is because of the fact that the blood circulation level in the muscles increases to large extent that leads that their muscles look bigger. Exactly the same thing going on with the muscles of the spine. They increase in size, push the intervertebral discs inside, the vertebrae move away from each other, inside creating vacuum effect. And in this moment, fiber ring begin absorb fluid intensively straight from the muscle tissue. In turn to control group, who does not exercise at all, they have approximately the same processes, but much less intensely. In horizontal position, when vertebrae move away from each other, the fiber ring also start absorbing fluid. Fluid from muscles, and muscles become dry, which lead to the slight injury on the spine during the sudden movements. Also, liquid can be absorbed directly from the bone tissue. There is also liquid in the bone tissue, but it's very specific water, calcified water. And this calcified water begins to integrate to the intervertebral discs, which have a cartilaginous structure. Intervertebral disc, it is soft, elastic. Liquid under the influence of calcium integrates into this soft structure, and intervertebral discs lose his elasticity that lead to development other pathological processes, such as protrusion or hernia. Thus, in order to effect a condition which we know as osteochondrosis, we need a physical exercises. We are not able to stop this process, but we can slow it down and quite significantly. Practice more or less regular exercise. But not only exercises affect on condition of the intervertebral discs. There are also a number of factors which we will sort out now. We will take a certain person. Suppose he is a yoga teacher. He knows how to practice, he performs postures with the right alignment and practices regularly. But he has ongoing process in thinning of the intervertebral discs. What is the reason? Here we also recommend you to stop the video, stop lecture, and think what other reasons affect the rate of development of osteochondrosis. And there is this yoga teacher. He knows about that we need to exercise. That he does. But at the same time, the thinning of intervertebral discs continues. Next reason, which we will sort out, it's collagen's level in his body. The thing is that many yoga practitioners put their meals to the veganism or vegetarianism. But at the same time, their diet is not balanced, and that material which they consume is not suitable as a building material for the body. This leads to deficiency of certain elements. And right now we're talking about collagen. In order to understand is there enough collagen in your body or not, there is the very simple test with the elbow or knee joint. If your elbow or knee joint goes into the minus band, so-called hyperextension, and your joint before that wasn't traumatized, this is the direct symptom of deficiency of the collagen in your body. In this situation, we would recommend food supplements. Unfortunately so. We recommend hydrolyzed collagen 6,000 to 10,000 milligrams daily. enriched with the vitamin C, for better quality of assimilation of this element. It's need to be taken during 3-month daily intake, then 3-month break, and another 3 months of consumption. There is 9 months include a full therapeutic program. So our yoga teacher performs practice daily and takes supplements. However, and the process of thinning of the discs continues. Osteochondrosis is not slow down. The thing is that he generally doesn't have enough fluids in his body. According to the recommendation of authoritative sources, we have to take a certain amount of liquid to maintain water and salt balance. Really very important to maintain water and salt balance in the body. However, the amount of fluid consumed should not depend to any sources. We should rely to the real feeling of thirst. Your body will inform you when it needs extra liquid. The fact is that excessive liquid consumption can lead to decreased kidney function. In the tradition of Ashtanga Vinyasa practice, it is recommended to drink 2 coconuts before the practice starts. This is to compensate the needs of liquid in the body during the practice. Here we are talking about Indian coconuts. It's approximately 150 milliliters each. That is 300 milliliters of liquid you need to take in order to make your body feel comfortable during the practice. So our yoga teacher realized the need to maintain the water-salt balance in the body and drink enough water, based on body signals, particularly thirst. But the process in thinning disc continues despite of what he does every day. Takes supplements and drinks enough liquid. Why is this happening? The thing it is an important part of maintain health spine is the rest. Our yoga teacher practiced twice a day. What is better to avoid? For what reason? When we practice, our body can experience pain. Usually this is what happens. Any painful sensations. This is also a message that our body sends to the brain. What is this message about? There is some distraction in the body. So let's clarify. Light pain is the minor distraction. Serious pain is a serious distraction. Doing practice daily, traditionally in an hour and a half or 2 hours a day, 22 hours, the body needed to recover. This aspect cannot be ignored. So how can this lead to the serious inflammatory processes? And as a consequences, formation of connection tissue in the muscle tissue. And of course, 1 day a week off. So now we know. In order to effect the condition of osteochondrosis, we need to follow just 4 simple rules. Firstly is more or less regular exercises. The second is maintain water-salt balance. The third is a collagen level control. And the third is the adequate schedule of workout and rest. Thank you for your attention. See you again. Namaste.